The American Academy of Pediatrics and the United States Preventative Task Force recommends that primary care clinicians apply fluoride varnish to the teeth of all infants and children. The first application should be applied with the appearance of the first primary tooth. Through age 5, all children should receive a professional fluoride treatment at least every 6 months in the primary care medical home. Higher risk children should receive fluoride varnish application every 3 months. Fluoride varnish is safe and effective. It is also inexpensive, easily applied, strengthens enamel, and prevents initiation of disease. Studies have demonstrated a 38% reduction in caries with use. When part of a well-child visit, the whole process can take less than a minute to apply fluoride varnish. There are a wide range of behavior guidance techniques to meet the needs of an individual child and be tolerant and flexible in their implementation. Some examples of these techniques are communicative guidance. At the beginning of an appointment, ask questions with active and reflective listening to help establish trust with a child. Tell, show, do. Verbal explanations of procedures appropriate to the developmental level of the patient. Demonstrations for the patient of the visual, auditory, olfactory, and tactile aspects of the procedure. And then, without deviating from the explanation and demonstration, completion of the procedure. Ask, tell, ask involves inquiring about the patient's visit and feelings toward or about any planned procedures. Explaining the procedures through demonstrations and non-threatening language appropriate to the cognitive level of the patient. And again, inquiring if the patient understands and how he or she feels about the impending treatment. Positive reinforcement. Positive reinforcement rewards desired behaviors, thereby strengthening the likelihood of recurrence of those behaviors. Distraction. Giving a patient a short break during a stressful procedure can be an effective use of distraction prior to considering more advanced behavior guidance techniques. Remember, documentation of a child's behavior serves as an aid for future appointments and will help practitioners better plan for subsequent visits. Your setup includes gloves, gauze, and fluoride varnish single-dose unit. After washing your hands, put your gloves on. Small children are best positioned when lying down. For infants and toddlers, the knee-to-knee oral examination allows you to carefully examine the child's teeth with assistance from a caregiver. The child is held facing the caregiver in a straddle position. Lean the child back onto the healthcare provider while the caregiver holds the child's hands. The provider performs an exam while the caregiver holds the child's hands and legs. First, you want to lift the lip. Look at all the teeth, front, back, and sides. Note plaque, white spots, cavities, abscesses, and damaged teeth. Remember, if the child cries, it will actually help your ability to see. To apply fluoride varnish, use gauze to dry the teeth as much as possible. Varnish does not adhere well if teeth are wet. Apply a thin layer to all tooth surfaces with a brush. Apply varnish to dried teeth. Saliva contamination after application is fine as varnish sets in contact with saliva. Apply a thin layer of fluoride varnish to all surfaces of the teeth, both the front and back of each tooth. Be sure to paint the chewing surfaces of molars. Most providers apply the varnish in quadrants to be sure to paint all the teeth that are present in children 2 years and older, who typically have 20 teeth. Start with the upper back teeth, then move down to the lower left, then lower right, then upper back, and finally the front upper and front lower teeth. This process will ensure the high-risk anterior teeth are not missed. You will not need to use all the varnish within the single-dose fluoride application unit. Explain to the child's caregiver that it is recommended that you do not brush the child's teeth the night after the fluoride varnish application. Brushing will remove the varnish. The child should have soft foods for the rest of the day. Avoid hot, sticky, or hard foods for 24 hours. Provide preventive advice to the parent or caregiver. You should emphasize the importance of regular toothbrushing, offer dietary counseling in regard to the amount and frequency of refined carbohydrate intake. Provide systemic fluoride prescription if necessary. Arrange a referral to a dental home if needed. Take-home messages. The first application should be applied with the appearance of the first primary tooth through age 5, at least every 6 months. If a child does not have an established dental home, they should be referred to a dentist. If a child is high risk, they should receive a fluoride varnish application every 3 months. Aftercare instructions include: do not brush the child's teeth the night after the fluoride varnish application. Brushing will remove the varnish. Give your child soft foods for the rest of the day. Avoid hot, sticky, or hard foods. Verify with parents and caregivers that well water has been tested. Write a prescription for fluoride supplementation if necessary. Please visit FromTheFirstTooth.org for more information. There are many resources for healthcare providers, and parent educational materials are available for your office, which can be ordered in multiple languages.